Hi everyone, welcome back to our Ask the Doc segment for our Facebook page here at the Parkinson Center of Oregon. I'm here with Dr. Matt Brodsky, and he's here to answer a couple questions. So Dr. Brodsky, this person wants to know why do you think some people with Parkinson's disease progress very slowly or slower than some other people with Parkinson's disease, and they progress more rapidly?
Well, that's a good question, Jason. I think that the answer is complicated, and that first of all, I think the term Parkinson's disease is a bit of a misnomer, and we're really talking about a syndrome for which there is a sort of final common denominator, if you will, of having slowed movements, arresting tremor, muscle rigidity, along with certain features in the history that we use to make a diagnosis of Parkinson's disease, when in fact the causes of Parkinson's disease themselves are quite variable. And so because of that, that is possibly the reason why we see such a variable rate of progression of this syndrome. We've learned a lot about the genetics of Parkinson's disease, for example, and inheriting just a single gene mutation can significantly increase your risk of developing Parkinson's disease. But for all these single gene mutations that have been identified, they still account for less than 10% of all cases of sporadic Parkinson's disease. We know a bit about environmental risk factors for Parkinson's as well, and likely the cause of Parkinson's disease in one person is different than the cause in another. And so because we're talking about different causes, even though they have this final common denominator, we have seen that the rate of progression can vary considerably. There are some clues that we use to try to determine how fast or slow one might progress. And one example, for example, is that people who have the so-called tremor predominant form of Parkinson's, where they have a lot of tremor as a sign and symptom of their Parkinson's disease, tend to progress relatively more slowly than those who have a diagnosis of Parkinson's disease but do not have tremor or have very little tremor.
All right, well, thank you very much, Dr. Brodsky, and thank you to everyone for tuning into our Facebook page for our Ask the Doc segment. We'll be continuing to post questions, and as always, please post your own questions that you'd like us to answer, because we do check the page, and we will answer any questions posed by patients or just anybody else that wants to post a question. Also, we have a YouTube page for Parkinson Center of Oregon that will feature all of these videos together, so if you want to just check it directly on YouTube, you can do that. So thank you, everybody, and we'll see you soon.
Bye.